Hi, I'm Shelley DuBois. I cover healthcare for the Tennessean, and I'm here with Carrie Fry, who is the Navigator Program Lead for the Tennessee Primary Care Association, and Alex Tolbert, who is the founder and CEO of Bernard Health. And we're going to talk a little bit about some issues that they're facing, some questions they're facing from people who are seeking help getting healthcare. So one kind of main story that's out there is that people have been confused about the deadline for Medicare enrollment versus enrolling in federal exchanges. Is that actually happening? Is that something that you're seeing? What kinds of questions are customers bringing to you about that?
Yeah, it's definitely a question and an issue that we're seeing. I think maybe the bigger issue with Medicare and the health insurance marketplace is, if I have Medicare, do I need to do anything? And the answer is no. If you have Medicare, you're good to go. But there has been some confusion also as to the deadlines, because the Medicare open enrollment deadline is December 7th, whereas the health insurance marketplace deadline has been extended to December 23rd.
I see. What about you? Are people coming in and they're looking at their plans?
Yes, I mean we do have a huge amount of Medicare clients that come in, and they come in. I mean, a fair percentage of them come in every year because of the Part D formulary changes that happen. So Part D is the part of Medicare that's for prescription drugs, and so because the carriers can change the formularies, people want to check to make sure that their drugs are going to be covered, and if they're not, they can change. But to Carrie's point, you don't have to do anything. You can keep what you have. Some also just want to look. I mean, HealthSpring and Blue Cross both had pretty big changes to their Medicare Advantage offerings this year, which caused people to want to look at making changes. But all of that is really completely unrelated to healthcare reform and all the news people see about that.
So why, in your opinion, are people confused?
I think part of the confusion is because open enrollment opened at the same time, and they ran on very similar timelines. And I also think that there's not been a lot of information about what people who have Medicare need to do in terms of healthcare reform. And that's been one of our goals as navigators with the Tennessee Primary Care Association. We get a lot of calls, and a lot of people who are enrolled in Medicare show up at our events. And so we try and steer them in the right place to get the assistance that they need, but also assure them that there's nothing in terms of healthcare reform. Yeah, nothing in terms of healthcare reform that they need to do.
Well, so another thing that I've heard is that healthcare reform has sort of been a catalyst for people just thinking more about their health insurance, right? And it's and for people specifically, for individuals, sort of looking at their own plans. Has that carried over? And that's been in the private market, but has that carried over to Medicare? Are people examining their Medicare plans in ways that they haven't before?
That's a good question. I'm not sure that I could say that we've seen a big jump in people looking at their Medicare more closely as a result of healthcare reform. They were looking at it closely last year. Now, I think that the overall trend of people looking at things more closely will eventually impact both, under 65 and over 65. So that's a good thought.
And if anyone needed to enroll and missed the deadline, is anybody stuck? If they got confused and thought that the deadline was December 15th instead of December 7th, or has that not been an issue that you guys have seen?
Are you saying so for Medicare?
Yeah.
No, I mean, Medicare open enrollment is over right now. There may be some things that can be done, but no, I mean, you'd be done.
Could you enroll in a private plan, a private insurance plan?
Well, I mean, that's a good question. There are, even Kathleen Sebelius got this confused herself when she was testifying in Congress. She said she wouldn't be eligible for, an exchange plan or marketplace plan, and that's a good thing to think about, or to bring up. The reason for the confusion is what she really meant is that she wouldn't qualify for a subsidy, right? So she wouldn't be able to get a subsidy to buy coverage. So
right.
when people ask questions about, well, can I buy on the exchange? Anybody can buy on the exchange. the question is around whether you're going to be eligible for a subsidy. So like, Secretary Sebelius absolutely could buy a policy on the exchange, just wouldn't get a subsidy from the government. By the same token, like there are a lot of people out there who never paid into Medicare. They're never going to be Medicare eligible. Could they buy a policy on the exchange? Absolutely, right? In fact, you can come up with a lot of situations where people can find themselves at the sharp corners of our healthcare system, and they're going to be able to do things like they wouldn't have thought they'd be able to do, which I think is part of the reason we have our roles.
Yeah.
Yeah. And to Alex's point, those people who never did pay into Medicare and who will never be eligible for premium, what we are calling premium-free Medicare, they actually can go on the exchange and qualify for those subsidies, whereas people who have premium-free Part A can't go and get subsidies on the health insurance marketplace.
Yeah,
Which kind of goes back to when you were saying, why are people confused? Because it's really confusing.
It's really confusing.
It's like unbelievably confusing. I mean, it's
Yeah.
amazing, right?
Yeah.
And it's one of those things where anything where you've got, right, the federal government is involved, and the federal government has its agenda and its ideas, and they're good ideas, and people are working hard. And then you've got state governments, and they've got ideas, and they've got agendas and things, I think. Then you have, employers, and employers have ideas about how they think it ought to be. And then there's like the regular old individuals like, you and me, and like we happen to think we have ideas about how we want it to be. So you have all these conflicting agendas and ideas and all like pretty powerful entities. And the result is it's really confusing.
And everyone's a major stakeholder, right? This is what everyone at every level is so passionate about.
Mm-hmm.
Their different ideas.
Yes,
Mhm.
and it doesn't help that it changes every single day. Like every single day, there's some sort of change to something. In fact, we are like doing presentations, and we're like, oh, actually, this is not the same as it was yesterday because we made this presentation yesterday, and overnight something changed. So I think that's contributed a lot to the confusion, is that things are changing so rapidly because this is an unprecedented piece of legislation.
Yeah.
And so I think that it's made it very confusing for a lot of people.
Right, and that's something I wanted to ask you guys about. So this is a thread that's sort of out there. Media outlets have picked up on this Medicare enrollment versus federal exchange enrollment difference and the confusion. Are there any other main issues that people are confused about that they kind of conflate when they come and talk to you?
I think one of the big confusions is that the Affordable Care Act in the health insurance marketplace is for everyone. And as Alex said, everyone can go on to the health insurance marketplace and buy a policy, but there are varying different regulations that prevent people from getting subsidies. So what we're seeing a lot is people who may fall under 100% of the federal poverty level and aren't qualifying for those subsidies, and they thought that they were going to because it's been portrayed as this is something for everyone. Or the people who their spouse has an employer-sponsored insurance, and there's a spousal offer of coverage. And those people can't go onto the exchange and get premium tax credits and cost-sharing reductions, and they thought that they were going to be able to. And so that's a lot of the confusion that we're combating now is that idea that this was something for everyone, when in reality there are regulations that make it not so.
Right.
Yeah, and I can think of a few areas where people get confused on a kind of ongoing basis. So one would be if your employer's premiums cost you more than 9.5% of your income, then you're supposed to be able to qualify for a subsidy.
Which is a kind of
Squishy.
tricky to calculate anyway.
It's tricky
right?
to calculate, but then also people will say, well, employee only for me is free, but to add my family members, that costs $800 a month, so it's $10,000 a year. I mean, that's way more than 9.5%. So like we definitely qualify for subsidies, and you don't, because that 9.5% only looks at the cost of the employee-only coverage tier. And so that can lead to a lot of anxiety and anger, frankly, when that's realized. And that's one of the situations where if you're a small employer and you're providing a group health plan because you think you're doing well by your employees, you could actually be harming them because you're preventing them from getting those subsidies. So that's one. Another one that we see is that medical providers have got a lot at stake in healthcare reform. I mean, they've got big Medicare cuts coming and things that they expected were going to all be recouped by people just kind of magically getting health insurance because it was going to be like, Kayak, right, or Expedia. But it's not been like that. And so, I would say the confusion there is providers at this point continuing to think that their patients that are currently uninsured right now will just get signed up when if they aren't doing anything to help them sign up,
I see.
they're not going to.
So you need someone to sort of guide you through that process. Well, I know that everyone is grateful for the work that you're doing, guiding people through this very complicated process. Carrie, Alex, thank you so much for coming in.
Thank you.
For more on how healthcare reform and the Affordable Care Act affects you, go to Tennessean.com/ACA. I'm Shelley Du Bois with the Tennessean. Thanks for watching.